So this is how I make a clinical assessment that distinguishes impulsivity as a symptom of a mental illness from spontaneity as a normal, healthy behavior in an individual. On the outside, spontaneity and impulsivity look very similar, but they're quite different, especially in the condition in which they occur. So for impulsivity, it tends to occur in an environment that is unstable, unstructured, disorganized, chaotic, meaning a person with symptoms of impulsivity would have a disruption in their routine. They would not actually have a stable, steady routine that they conform to. Whereas with spontaneity, what makes it healthy is that it exists in a very structured environment that is organized. And so it's an interruption or a disruption to structure that once it's disrupted, or the routine once it's disrupted, then a person very quickly comes back to the routine or to the structure. And so for example, a person may decide to watch a movie on Saturday, but Sunday they're going to go back to their sleeping pattern. So when they watch a movie, they might stay up a bit late. So if usually they go to bed at 9:30 or 10 p.m., on that Saturday night they're going to go to bed at 2 a.m. So it would be a spontaneous behavior to decide to stay up late. But then the next day they very quickly come back to the structure of routine that they've cultivated or they've created for themselves. And so that becomes a healthy interruption to a routine that the person complies to. Whereas impulsivity, there's usually chaos going on in the person's life, either because their sleep pattern is not consistent. So sometimes they sleep at 9, sometimes they sleep at 12, sometimes they sleep during the day. They don't have a consistent sleeping pattern. Their meals are also very disorganized, so they can have breakfast or not have breakfast, or they can have lunch or not have lunch. Their level of activity also varies through the day. So there's essentially no predictability in their life, in most areas of their life. And that's why impulsivity is prevalent. Whereas spontaneity, there's a lot of predictability. And so when they introduce one aspect or one factor of unpredictability where they decide to be spontaneous in an activity, then it actually brings in some taste, some flavor to life. And so spontaneity is important and it's healthy in actually uplifting or increasing our quality of life. So when you're assessing yourself, you want to look at the conditions in which this symptom is being assessed. I'll repeat, impulsivity tends to occur in conditions where chaos already exists, whereas spontaneity tends to occur in conditions where there's organization, there's structure, and there's routine.